A high-risk surgery to cure a rare and deadly heart condition was a huge success for one Montana woman. Now she's sharing her story in the hopes that it can encourage others to think of how to manage serious medical decisions. Ren Wadsworth tells us more.
Behind me is an echocardiogram of Mary Jo Stevens' heart before her operation. Now she attributes her successful recovery to her caregivers and physicians at Billings Clinic, and to her decision to put a power of attorney in place to make medical decisions for her. Mary Jo lives an active life and spends much of her free time doing projects or spending time in nature. But in the winter of 2023, something went wrong. Jo had difficulty breathing and speaking and became debilitatingly tired easily. She attributed these symptoms to her age until they got much worse in July 2024, forcing her to seek medical attention. At Billings Clinic, Jo was diagnosed with multivalvular endocarditis, which is considered highly uncommon and oftentimes fatal. To treat it, her physician recommended surgery.
That's what it takes sometimes of, surgical management of that, also carries up to a 30% mortality. There's a high risk that she couldn't, wouldn't survive. So we discussed that with her, and she's a very strong woman and had the will to get through this, and that's a big part of that. She was very strong for her age and wanted to pursue surgical management to get better and get healthy. And so that's what we did. We ended up doing surgery, and we ended up replacing her aortic valve and repairing her tricuspid valve.
Dr. Genovese also explains that any kind of heart surgery causes trauma to the patient and says it can be considered one of the biggest events of a person's life. Jo didn't want to go through the experience alone and wanted to ensure her wishes were honored no matter what happened. So she assigned her niece as the power of attorney in charge of her healthcare decisions.
She knew all along that she was a power of attorney who's supposed to do something that I want done, not that she or somebody in the family wants done. I don't remember hardly anything just because I was in anesthesia.
Jo encourages everyone to consider assigning a medical person of power of attorney as soon as possible, regardless of your age or health status. She explains that accidents can happen at any time to anyone, and once they do, it may be too late to set a proper power of attorney, leaving decisions in doctors' hands if you are incapable of making them for yourself.
So trying to scramble at the last minute when the person's already very ill and about to go into surgery is just not the situation you want to be in. So just addressing it now when everybody is healthy and well, and you can have a very comfortable conversation with them about what they would want if something were to happen, rather than when they're sick and they may be really upset or nervous about going into this medical procedure.
Jo's surgery was a huge success, and now she only has 3 months left of treatment. After that, Jo says she's eager to return to fly fishing and competitive shooting, though she jokes she may be switching firing sides soon due to her new pacemaker. Back to you, John.